Hello, and thank you for tuning in to Straight Talk for Texas Trustees. My name is Susanna Ramshaw, and I oversee trustee programs and engagement for Texas Healthcare Trustees. This new program is a series of pre-recorded conversations between healthcare governance expert Pam Knecht, President and CEO of Accord Limited, and THT's network of hospital trustees and executive leadership. As our facilitator, Pam will guide our participants through various issue areas affecting hospitals and boards across the state to share insights and lessons learned regarding effective governance and leadership. Today's conversation, Ensuring Financial Stability for the Future, is generously sponsored by Hilltop Securities. To learn more about their offerings, please visit hilltopsecurities.com. We are joined today by Brad Holland, CEO of Hendrick Health System in Abilene, Texas. Joining him is J.V. Martin, who serves as a trustee at the same organization, and Chris Janning, Managing Director at Hilltop Securities in Dallas, Texas. Just quickly, I'd like to give you a few fast facts about Hendrick Health System. They are a Abilene is a mid-sized city with rural surroundings. The hospital itself is a not-for-profit 501c3 with 540 licensed beds. And it's one of the largest employers in the city with 3,600 plus employees. And they have a 15-member board of trustees. You'll be able to access this information on our website when you're viewing this recording, so feel free to download the slides. So without further ado, Pam, I will hand it over to you to begin Straight Talk.
Thanks, Susanna. I appreciate the opportunity to be involved in this exciting program, and I want to thank our panelists because they've already been working with Susanna and me to make sure that we are ready for this conversation. So let's go ahead and start with an initial question based on the fact that every board, as one of its key responsibilities, has to make sure that the finances of the organization are stable and secure. So what is some initial advice that you have for boards overseeing financial health of their organization? JV, could you start us out with that?
Sure, Pam. Thank you very much. It's my pleasure to be here this morning. You know, you really need a strong governance committee. We started a governance committee approximately 6 years ago, and they do the selection and nominations for our board. We're a very diversified board. We do have several accountants. We have several bankers or ex-bankers on our board, and with a lot of financial savvy about them. But we also have large business owners as well as small business owners on our board that help also in our financial decisions. So your diversity of your board needs to always have a good selection of people that understand the financial part of the financial statements and the income statements.
Right. So that may seem basic to some of our listeners, but I think there are too many boards that don't pay enough attention to making sure they actually have people serving on the board who can understand what management is saying to them about various financial reports. So it's great that you've taken such a proactive approach to that. Well, let me then ask a broader question. Since Chris works with lots of different hospitals and health systems, Chris, I'm wondering what general advice you have as you think about what boards ought to be doing to help ensure financial security of their organizations.
Sure, thanks, Pam. You know, the funny thing is, JV said, you know, the first thing the boards need to do is you need to have the right people, and especially on your finance committee, to make the right kind of decisions for sound financial health. You know, the business of finance and money is no different than the business of healthcare operations. Things become a whole lot easier and a lot more effective with data in it. And one of the things we always ask our clients is, you know, what are you monitoring? Do you have financial benchmarks? You know, do you have a dashboard that you follow? How do you know if you're on the right track? How do you know if you're coming off the track, or if you're doing well? And that's what a good financial dashboard will do. And what we've prepared as an example today for everybody listening in is, you know, what are the key financial ratios right now, whether you're a banker or a bond investor, or really a financial administrator or a financial officer at a hospital. You know, what should you be paying attention to? What's important? And what you'll see is, you know, first and foremost, what's your excess margin, your bottom line? How are we doing? In this dashboard, you'll notice, just for broad appeal, I've used what is called the Moody's BAA median. That is minimum investment grade. And, I've been an advisor for over 30 years. And one of the things I tell literally all of my client boards and new clients is, look, I know these can be high standards. I know they can be daunting standards. But if you're not measuring against these, and if you're not long-term investment grade, where investors and bankers and professionals in finance would lend you money because they know they're going to get paid back and paid back in a timely manner, to me, that's a question mark. Everybody looks at bottom line. The next most important thing that you'll see is days cash on hand. Days accounts receivable. Again, we can all be billing, we can all have it, but if the cash flow is not coming back in and you don't have that cash, the first thing to be looking at is, hey, what's going on with our AR, and then digging into if it's growing, why. Fundamentally, debt service coverage. We all have debt. It's the American way. We want to go into that, and how do you know when you have too much debt? How do we know if our debt load is manageable? Again, these benchmarks against what does it take for the minimum investment grade, minimum long-term financial stability quality? Debt to cash flow, capital spending ratio. Again, one way that we have seen at Hilltop that clients, you can see a red flag building is if in order to build up cash flow, you're deferring investment in capital. We all know how capital intensive healthcare is today. While that might be great for cash flow and it might keep your financial medians up, it can sure get your cart off in the ditch in a hurry over a period of years. So again, it's something that investors and bankers look at. And then finally, related to that would be average age of plan. Along with your capital spending ratio, it's coming down. And what are you investing your money in? What kind of capital, and what's the useful life of your capital, and those trend lines. And again,
Chris,
just good sound fundamental data for people. And if you give this to your board members, we found the board members will be able to lead very effectively.
Yeah, that's what I wanted to follow up on, Chris, is that one of the things I really like about this dashboard and ones like it is that it's color coded so that the board then can get this kind of a report from management and know how well the organization is doing vis-a-vis the benchmarks and their own targets. So you can tell what's green, the board shouldn't have to talk about. Maybe you talk about some of the things that are yellow, because that I think is implying you may or may not be doing well vis-a-vis that particular benchmark. And then the red one, obviously, the board needs to really ask management, well, why is that happening? What are you doing about it? Did we set the right target? How is it that we need to change what you're doing, management, to make sure that we are financially stable?
Pam, that's exactly right. And then related to that, you'll notice we put a trend line in here. We didn't just put the current current year-to-date snapshot. We would encourage a period of years so you can see where have we been, what have we been doing, and then now how are we performing? Because again, professional board members that understand finance are going to understand the trend can be more important sometimes than the current data snap point.
Brad, I'm wondering if you had anything you wanted to add to this conversation in general about ensuring financial stability before I ask you to talk more specifically about Hendrick.
Great. Well, Pam and Susanna, I appreciate y'all hosting and having us, and JV and Chris, appreciate y'all being a colleague on the panel today. I would say that JV and Chris have hit the nail on the head. JV's perspective of having the right people on the board, and if that's governance with financial knowledge, that is key to understanding what some of the financial dashboards even mean, because you do not want to be in a position where ignorance is not bliss on board governance. And Chris has done an outstanding job of laying out a financial dashboard. I really like the color-coded philosophy from management's perspective. I like to go for the green, and so from an operator, someone who is to perform, you really want your leadership to perform to the metrics that are set out. I would say the only thing I would add is these are excellent financial dashboards, but you also need to know what creates the cash that allows you to achieve these metrics. So I think at least at Hendrick, we supplement the financial dashboard with an operating metric dashboard that is also equally color-coded, because it's those operating metrics drive the cash. And so you have to understand from your organization, are you paid on a fee-for-service basis? Are you paid by your ED visits, your outpatient visits, your inpatient admissions? What is driving the cash so you can have a margin, so you can go for the green on your financial dashboard? So I would just add that as a management, you drive cash by operating metrics. And so I think that's equally something that a governance board would look at, making sure you know how you're paid, fee for service, DRGs, value, whatever that is, because that's going to drive your financial performance as well.
Great. Yeah, that's a key point. And I'm thinking maybe Susanna can help us after this particular program to see if we might be able to get some samples of the operating dashboards, so that would be, you know, in parallel with the financial dashboard. So we can talk about that afterwards. Brad, let me go ahead and ask you to pick up on the second big question we had, which is what financial issues have you encountered at Hendrick due to COVID-19, and what actions have you taken?
Well, I don't know how long we have for this presentation, but I think everybody in healthcare knows that COVID-19 has had a huge financial impact in healthcare. But financially, what most people don't realize is that healthcare is not immune to COVID-19. What we hear about is patient surges of COVID-19 patients, and the hospitals have all this business. And most people don't realize that financially, hospitals have taken it on the chin, just like predominantly 99% of the other businesses. So healthcare has not been immune to the COVID-19 financial carnage. I would say that we're in it just like everybody else. First of all, there have been increased costs associated with COVID-19. If that is from going out and sourcing new PPE, and because there's been a limited number of PPE, that therefore the price of PPE has skyrocketed. We've gone out and sourced new relationships for testing capability that we previously didn't have. So I would say that increased cost of testing, the increased cost of compliance for our staff, increasing our staffing, retaining staff for potential surges that may or may not have come, ensuring that we continued to pay for staff to prepare for the surge, and the increased cost of PPE. So what we've seen is our costs have gone up, but at the same time, when COVID hit, our volume plummeted. So because people were scared to go to the hospital or go out in public, or the economy was shut down, all elective surgeries dried up and were postponed. And so we've seen the cost of the reimbursements plummet, which is why you're seeing insurance companies have record profits today, because no one is spending money on health care. And so what the hospital has had, double whammy, a decrease in revenue and an increase in expense preparing for surges. One of the biggest reductions is revenue is when the government basically shut down elective surgeries, and recognizing elective surgeries make up a large proportion of the margin of hospitals, that exponentially took a hit to all hospitals. Across the industry, what we saw is COVID-19 really hit hospitals in late March, and they felt the full impact in April. And across the industry, I think the average operating industry, excluding any financial stimulus that came from the governments, was a negative 40% operating margin in April. And so since then, hospitals have been trying to climb their way out of that. And I would say at this point, most have not, although it's not as bad as it was. I would say without any of that federal stimulus, there wouldn't I'm not sure anybody could have stayed in business today. So at this point in time, what each hospital is trying to do is keep their head above water. They're doing that by pivoting to telemedicine. They are doing that by reducing outpatient services, reallocating staff to COVID where necessary. You're seeing industries, I think 35% of executives have taken some sort of pay reduction. There's been furloughing of staff. There's been reductions across the board just to try to maintain some sort of resemblance of cash flow and margin. So once you've seen one response, I think you've only seen one. At Hendrick specifically, we have a very supportive board that has been trying to not have furloughs and not reduce pay across the board because we see that we're in this for the long haul. So we've tried to mitigate any short-term damages by taking a long-term approach and reducing non-labor expenses where we can, managing to volume where we can, maintaining our workforce by pivoting on the revenue and promoting telemedicine.
Thank you for that detailed explanation of what you see going on throughout the industry and then specifically at Hendrick. When we spoke earlier in preparation for this conversation, I heard from you that the board had set some specific strategic priorities that you decided to continue to pursue despite the fact that you were having some financial challenges. And JV, I wonder if you could tell us a little bit about those particular strategic initiatives that you continued with.
Yes, Pam. In our strategic planning over the last maybe 2 or 3 years, we realized that we were reaching capacity in our hospital. And, you know, we had to make some decisions, think about decisions, plan on things, whether we continue to do more construction of our existing campus, or we would look at urgent care centers. We've been so popular in larger communities and everything, and are possibly acquisitions of other hospitals. Well, when we hired Brad approximately 19 to 20 months ago as our 5th CEO in the history of our almost 100-year hospital, Brad came on with some fantastic ideas about the urgent care. And we have just recently broken ground for 2 urgent care centers in Abilene, Texas, and 1 in Brownwood, Texas. And we said also, as you may know, that we are also looking at the possibility and have signed a tentative agreement to purchase 2 additional hospitals, and we're just waiting for state government approval on that. And so with Brad, under Brad's leadership and the aggressiveness of our board, you know, we continue. But the thing about it, you know, we're preparing financially for those acquisitions and also the urgent care centers as much as we are in the need for them.
Thanks. Yeah, you're teeing up another question I wanted to ask in relation to that is, well, how is it then that you were able to continue these strategic initiatives despite some financial challenges, as Brad explained, from COVID? And Chris, I know you've been assisting Hendrick. Could you speak a little bit to how you think that the Hendrick's board and management team laid the foundation for being able to continue their strategic initiatives?
Yeah, absolutely. Thanks, Pam. I think the most important thing, again, was we began utilizing the Hendrick management team, as Brad mentioned in his comments, has an extensive dashboard. They do have a long-term plan. Working with that long-term plan, you know, we worked with the financial staff there to look at the impact. And one of the areas that we identified was liquidity. And when you looked at the dashboards that we reviewed, everything was about cash flow and cash balances, balance sheet health. So one of the first things we did was, but before we needed it, we reached out and we went to close to a dozen banks and financial institutions and said, look, the board has, you know, this is the priority. We are going to be moving forward. And we started soliciting bank term sheets for the liquidity that, because we knew The critical period will be the 1-year interim year during the acquisition. Once you get it and you're in and you're operating, long-term we knew, we were very confident in our ability to take it from there, if you will, take it from closing. Right in the middle of that process, talking to those banks is when COVID hit. And again, because we were planning, because we had been talking to the banks, because the banks knew and had been able to talk to us about the system, the plan, they knew our financial condition, they knew the financial management team from these conversations. We were able to close 3 bank facilities. So we absolutely know we have adequate liquidity. Again, we may or may not tap any of those facilities, but the very small cost that we're paying the banks for those commitments, while it might seem like a material amount of money, it's a whole lot less than interest. And then, Lord forbid, if something happened with the COVID and the reimbursement, all of the issues that Brad just outlined in his comments, if any of that comes to bear, we know we have signed, executed commitments, and that we will have adequate liquidity, to get us through this COVID and into, again, the health insurers, the state with its Medicaid program, the federal government with its Medicare programs, as well as the supplemental payments. It gives them time for them to generate the revenues that they know that all of the providers will be needing because of this COVID, but we'll be able to have the time, hopefully, to get them there. It's kind of a belt and suspenders.
So it sounds like you together took a very proactive approach. Brad, you want to speak a little bit more from your perspective on that?
Sure. We've touched on JV's thoughts as well as Chris's. I would say generally that the financial stability of Hendrick goes decades long. I mean, you look at the board, it didn't just happen overnight that Hendrick has a strong balance sheet. Hendrick has stayed true to core hospital operations. They have taken a conservative long-term approach to healthcare, and therefore they've been in a position to continue to make strategic long-term decisions because they have they're not working from quarter to quarter, they're looking from decade to decade long out. That's also the position they took when COVID hit. They're taking the Warren Buffett strategy of betting long-term on Texas or betting long-term in the United States, that this is going to be resolved in a year or two with vaccines and a positive result, because they're not focused in the next year, they're focused on the next decade. And so their buy versus build strategy, they felt that you could build, but they felt it was better to buy. You're also buying capacity or buying a revenue stream as well. And so that worked out for the organization. As far as continued investments in urgent cares and other strategies, again, they're taking that long-term approach towards consumerism, real-time and demand care, which is why we pivoted to telemedicine. And so we're in the middle of staying true to our core, but we're also trying to pivot to what we do believe the future will bring. But again, I can't say enough that this didn't happen just within a week or a year. This is a long-term philosophy that the board has taken. And when I was interviewed, they asked what my philosophy was towards technology and innovation. And I remember that they said they like to be on the cutting edge and not the bleeding edge. And I can't stress enough that is so accurate, because you can lose a lot of money by not being true to your core and being on the bleeding edge if you're not careful.
Right. So let's go ahead then and use that as a segue to our last question, which is, how then would you describe the role of your board in ensuring financial stability? Brad, you've already made a couple of comments in that regard. So could you speak to us about what you as the CEO think is the role of the board, what you hope the board would be doing in helping to ensure financial stability, some of which you've already mentioned, and then I'll come over to JV and ask him to comment too.
Well, I think that from the CEO's perspective or management, you're just completely aligned with your board's stability financially, because I do believe either there's two paths. You can shrink yourself to profitability, or you can grow to for profitability. And maybe at some different points in the life cycle of any organization, you may have to tap different strategies at different times. But no one organization can focus almost solely on one, because they do require a balance. But as far as governance goes, they provide goals and relationships and what I call a balanced scorecard for managing the performance of management. And those are across different organizational goals. And those may be quality goals, they may be volume goals, but equally or just as important is financial goals. And so it's, to me, it's the board provides well-rounded goals to management, and that aligns the incentives. And I think that's really what they've done very well here at Hendrick.
Good. So I know some boards and management teams find themselves a little confused about the role of the board versus the role of management in general. And that can also happen in terms of financial oversight. Brad, I'm curious how you feel. Has your board been staying at the right level, the governance level?
Yeah, absolutely. I describe, and I've heard it from our own management, from our own board. They don't want to micromanage. They set out goals. They are always available. They are integrated into our organization through different roles. And if that's attending MEC, if that's our audit committees, if that's our financial committees, mission and ministry, they are integrated into the operations of the organization, but they don't micromanage. If they give us a goal, and if that's if they require us to be at a 3% operating margin, happens to be the goal, they're not going to nitpick on how we achieve that financial goal, as long as they provide a well-balanced scorecard. If it's engagement is important, you can't squeeze financials at the expense of your employees. Well, if you're aligned on how you need to ensure that your employee engagement and satisfaction remains positive as well, again, it just goes out towards creating a balanced scorecard of accountability and letting management operate towards the metrics and the goals that the board set out. Now,
Thanks. So
they don't micromanage, but I can tell you an engaged board always makes themselves available, and they're always willing to be a good sounding board. And in fact, I find myself bringing ideas and asking for clarity and support in identifying these metrics. So I think it's equally up to management to seek advice as well from good governance.
Mm-hmm. So JV, can you tell us from your point of view, what do you think is the board's role, and how at Hendrick have you been able to create what sounds like a partnership between management and the board?
Thank you, Pam. As Brad mentioned, we do not micromanage at all, but we do have a very strong financial committee. We make sure that financial committee is strong each year as we change members in that committee and everything. Again, we do not micromanage, but we're not afraid to ask questions. If there's something you don't understand about something financial, or if you see something on the bench marking that you don't understand, or you see a major change on it, then ask those questions and get those clarifications on it and everything. Mm-hmm. And we have a very strong CFO that does an excellent job in presenting all of the financials to the full board. But then the financial committee spends, of course, even more time in going into the details. Brad provides us almost on a weekly basis updates about the COVID-19, how that's affecting us financially and everything. So the main thing is your board just needs to understand, and if they don't understand the financial side of it, then make sure you've got someone in that committee or on that board that does understand it. you know.
Mhm.
And so, but as far as at Hendrick Hospital, we get all the information we can desire, maybe even more than we desire sometimes. But no, I just encourage you to, as a board member, to be aware of everything that's going on, not just in the financial side, but in all of the operations of it. But you can do that without micromanaging and still be a good board member.
Mhm. I'm guessing that it requires that board members take the time to become educated, not just in terms of what management is telling them, but even outside of the boardroom. JV, would you say that's the case?
Yes, and of course, you know, THT has provided a lot of at our conferences. Unfortunately, we were unable to have this year and everything. Have some excellent speakers, and the education part of that. We have several of our board members that are certified trustees and going through that program. And so, yes, they do need to stay educated in all forms. And again, we actually have a kind of a rule or a standard for all of our board members that they have to have so many continuing education hours per year. And we on a quarterly basis, you know, provide the members of how they stand, you know, on their education hours at that time, and we encourage them to complete those before the end of the year.
Great. Well, this has been really helpful conversation, I'm sure, for all the THT members. And I wish we had even more time to continue talking to each of you about your advice for boards of hospitals and health systems. But I think for now, I'm going to go ahead and thank each of you and turn it back over to Susanna for some closing comments.
Yes, thank you so much. Really wonderful conversation. And we just appreciate your being candid and for being sort of a case study for us in ensuring financial stability. So thank you, JV. Thank you, Chris. Thank you, Brad. And good luck to you in the future. We'll keep tabs on you. Maybe we can do a part 2 next year to see how things have panned out for you all. Just as a reminder to all of you, this slide deck and some additional resources are available at our website. That's tht.org/straight talk. And we will have continuing education credit available for this program. As JV mentioned, if you have a certified healthcare trustee status or designation that's expiring and you need some additional hours, this counts. So please have a listen. And additional information about our speakers will be on our website as well. So episodes of Straight Talk for Texas Trustees will be dropping monthly on our website. So we encourage you to keep an eye out both on our website and social media and our newsletter for announcements about new episodes. Thank you again to Pam for your facilitation of this great conversation. And thank you to our speakers, and we'll see you next time. Thank you so much.